topic of my video is ABGS. I will give you some short tips so that you can easily determine what the diagnosis is when you have given an ABGS either in your OPD or in your final year examination or in MRCP. What we have are two mnemonics. Number one is PCB. Okay, these three things you are supposed to see in the ABGs of the patient: pH, carbon dioxide, and bicarb. Only these three factors are important to determine either it is respiratory acidosis or respiratory alkalosis or metabolic acidosis or metabolic alkalosis. Mnemonic number one is PCB and our mnemonic number two is CAR. That's all. These two you are supposed to remember. In the PCB we have pH, carbon dioxide and bicarb, which we are supposed to see whenever we interpret the ABGs. Next, and the other mnemonic is CAR, which stands for carbon dioxide, acid and respiratory, which I will explain it to you in a little while. So you have to remember just these. So one point that you have to remember is carbon dioxide is always an acid and it is always linked with respiratory. Okay, so whenever the carbon dioxide is increased, it means the acid is increased, hence acidosis. And since it is linked to respiratory, then it will be respiratory acidosis. And when carbon dioxide is decreased, it will be alkalosis. And that since linked to respiratory, it will be respiratory alkalosis. This is point one. Thing we have is a bicarb. That is a base and it is always metabolic. Okay, so what we have is if the bicarb increases, then it is alkalosis, and since it is linked to metabolic, then it will be metabolic alkalosis. And if it decreases, then it will be acidosis, because the base, if increases, will be alkalosis, and if its value is decreasing, then obviously it will cause acidosis in the body. So again, carbon dioxide, acid, respiratory, CAR. Acid increases, there will be acidosis. Acid decreases, there will be alkalosis, and this will be respiratory. Next, bicarb, base, metabolic. It increases, it will be alkalosis. It decreases, it will be acidosis, both linked with the metabolic. So at the end of this video on my YouTube page, I will upload some few questions that will be for practicing.
There are two more concepts that I want to add in this video. Number one is the concept of compensation, and the other is the concept of a mixed picture. These two types of questions can appear in the interpretation of the ABGs, so it is important. So first I will discuss the concept of compensation. Say there is a scenario in which there is a change in the pH and there's a change in the carbon dioxide, and also there is a change in the bicarb. So it gets a little confusing. What we are supposed to do is we have to make up a stepwise approach. First we have to see the pH of the patient. Say it is decreased, means the patient is having acidosis. Next we have to see either it is respiratory or metabolic. Say the patient's carbon dioxide is increased, hence it is a respiratory acidosis. We have made up our diagnosis in the step 2. Next, step 3. Step 3 is to look for the counterpart, that is the bicarb. Either it is normal or has it increased, to see if there is compensation for the acidosis going on in the body. If it is normal, it means it is just respiratory acidosis, and if it is increased, then it is respiratory acidosis with metabolic compensation. So in case of compensation, what you have to see is first, what is the diagnosis, either it is acidosis or alkalosis. Next, what is the cause, either it is respiratory or metabolic. Third is to look for the counter-regulatory factor, either if the respiratory acidosis is going on, then if there is any change in the metabolic part, or if there is a metabolic acidosis going on and there is any change in the respiratory part. This is very important in the interpretation of the ABGs. And the next concept is the concept of the mixed picture, in which you have to see either both the metabolic and respiratory are causing a specific change in the pH combined. Say the patient is having acidosis and the carbon dioxide is increased, hence respiratory acidosis, and bicarb is decreased, that is the base which is causing metabolic acidosis. So both these combined will give a picture of mixed acidosis. And I guess this is the most easiest way to interpret the ABGs. Thank you.